You're welcome to my channel. Thanks for visiting. Today I'll be addressing prostatic adenocarcinoma. This is just an excerpt from the full presentation on prostate cancer. To get the link to the full presentation on prostate cancer, you can go through this. That would take about 4 hours 30 minutes for you to get through from A to Z of prostate cancer. But as far as this excerpt is concerned, without further ado, let's go. But remember, when you're done, to subscribe, give thumbs up, give your comment, and share with your friends. I appreciate it. Okay, here is a good bus stop to stop. For now. Let's examine adenocarcinoma, but I will be precise in bringing out the name as prostatic adenocarcinoma. And why that? Adenocarcinoma is not peculiar to the prostate gland. As a matter of fact, it is found in all glands, all organs that could secrete throughout the body. So adenocarcinoma is from the glandular epithelial cells of the prostate. Here, prostatic adenocarcinoma. That will account for about more than 90%. In fact, some authorities will put it at 95, others put it at 99. You can almost close your eyes and tell anyone who could walk to your office and tell you that you have been diagnosed with prostatic cancer, that, okay, you are likely having prostatic adenocarcinoma, because greater than 90% of prostatic cancer diagnosed will be adenocarcinoma, prostatic adenocarcinoma, or adenocarcinoma of the prostate. This is the cancer that is found where the ducts and tubes are. The lining of it that is responsible for the fluid secreted by the prostate gland. There are two subtypes of adenocarcinoma, and I want us to get the facts about them very clearly. Remember, before now I've been telling you it is neither here nor there. You will get one of the many reasons why it is so right now. And the Acinar subtype of adenocarcinoma of the prostate is the commonest of all prostate cancers. It means it is commoner than prostatic ductal adenocarcinoma of the prostate. Now, the Acinar. Now, the Acinar cells are all over the prostate gland and through all the secreting tubes and ducts, okay? This will grow from the back, from the posterior parts of the prostate gland. Please get this right. When you look at the diagram I have shown you earlier, you can see that posteriorly we have the large intestine, particularly the rectum. Okay, so it is pretty close to the rectum. So when Acinar adenocarcinoma is growing and digital rectal examination is done, the physician is most likely going to pick it through DRE. You can feel it there. And this one will also shoot up the PSA. So PSA is high, digital rectal examination is picking something craggy and hard, and you say, okay, that is prostatic carcinoma. You are close to it, but let's have biopsy done, right? Now, another reason is that you may not have only that, you might have, other types present as well, right? But in the case of prostatic ductal adenocarcinoma, something is different. It's less common compared to the Acinar, right? But it is more dangerous. Well, it's good that it's not as common as the less dangerous one, okay? It can grow at the anterior or posterior or any part of the prostate gland. Unlike the Acinar that is growing more at the posterior part. This one can grow anywhere, within the prostate gland. But something is about to drop right now. Are you waiting for that? Get it. Prostatic ductal adenocarcinoma may not give you high level of PSA. So, when I've said repeatedly, that if you don't have high level of PSA, don't tell the patient, or you, the patient, don't go and be pumping champagne. If you have prostatic ductal adenocarcinoma, your PSA may not be high, yet you have a very dangerous cancer, more dangerous than the Acinar. Therefore, it is pretty easy to miss the diagnosis of prostatic ductal adenocarcinoma. Now, other types of prostatic cancer could be squamous cell carcinoma of the prostate, prostate sarcoma, transitional cell carcinoma. Remember, I have gone through transitional zone density the other time. When you get the prostate gland around the urethra zone, transitional zone, okay. Then the other type could be neuroendocrine tumors, like small cell carcinoma. So it's good we have been able to look at this so that we will get the entire picture why diagnosing prostate cancer seems to be a little bit cumbersome.